Happy Friday, folks. This is CC Rex, STM LLC. So this is a new YouTube channel where I'm going to focus on massage and massage techniques as it pertains to a couple different conditions. Hopefully it can educate folks and make sure that they have coverage and care and information that they may need that they didn't even know was available. So today's sponsor condition is spinal stenosis and massage therapy. So I picked that because I'm a person who suffers with that condition. And with spinal stenosis, it shortens and it kind of crushes on the nerve cells just a little bit, the ones that go through your vertebrae, especially the ones in your spine. And it makes everything a little bit more narrow. That causes pain, a good amount of pain. And it's not the worst pain I've ever been in, but it is something that I'm just like, you know what, at this point, I got to stop being Supergirl and trying to do everything. I'm going to take the time out. I'm going to rest. I'm going to get myself together a little bit sooner than before and make sure that I'm okay, because moving into the future, I don't see myself as a person who was going to sit still. Just don't see that. I know I have some notes here that I am going to be reading from. I wanted to make sure that this video was a little bit more polished for you guys, but in having real conversations, it doesn't always look like that sometimes, but the information within those conversations is what makes it beneficial. So I'm going to go ahead and do that for you guys today. As time moves on, it's going to be wonderfully made videos. Today, I just want to make sure I get it out because that is the point of the mission. So within these notes, and if you see me like looking down, it's because they're sitting here on my lap. So spinal stenosis is a condition that causes like the spaces in the spine to become narrow, and they compress the spinal cord and the corresponding nerves. If you can take, like, imagine like your finger being a nerve, and this space being what is called a foramen, which is like the holes or the spaces that are within your spine. Imagine the bone being just able to kind of crush your finger and around the finger. And it's not like your, nerves can really move out of that space, but so much. But it's like every once in a while, it gets inflamed and it starts to just kind of crush on those nerves, and it hurts. Oh, so bad. But you know what? There are ways that you can kind of get around it, and I'll talk about that just a little bit later. What causes that spinal stenosis? There's a couple different causes. Within that, it's caused by things like osteoarthritis and people who are a little bit older, and it's just because they've had a life and they've lived and they've done some things and they've had adventures and they've had some spills or tricks and things that have happened in their life, and they've taken little tumbles and falls, and this is one of the results. One of those things being, injury that causes this condition. One of them being like age, where it causes pain, it causes numbness, it causes weakness within the arms or in the legs. And in the arms, you could say spinal stenosis, and most people are used to it being like a low back kind of thing. It can also be a cervical, a neck kind of thing. And why does it affect the arms? Because all of the nerves that come out of your neck go down your arm, so it gives room for your fingers to wiggle. And every time that you have like a pain or numbness and tingling in your hands or in your arms, more likely than not, it's coming from this area of your neck. So that's where the arm thing comes from. And in your low back, they call it your SI joint. If any part of that is being impeded upon, that's where the nerve down the legs, most people call it like their sciatica. Just quick facts. We all have a sciatic nerve. That nerve kind of branches out down the legs. It's through the pelvis and down the legs, so that it can send like nerve messages to your thighs, your lower legs, and your feet. People use sciatica as a body part. Sciatica is not a body part. It's a body condition. Sciatica is where you have the inflammation of your sciatic nerve and it is causing you pain that goes down. So you have a sciatic nerve or you have sciatica. But we don't have my sciatica. Let's not claim the condition if we don't have it, or use it like it's a part of the body. It's not a part of the body, it's a condition of the body. And it makes me kind of chuckle a little bit when I think about being younger. Like, my family's from the Bahamas, and everything below, especially listen to like Remember My Grandmother talk, everything below your hip was your foot. So they say my foot hurt, and then when you point to where it is hurting, it was either at the thigh, at the knee, at the calf, or at the actual foot itself. So, I mean, there's nothing wrong in saying it, especially culturally where you understand what's going on. But to help your healthcare providers or those who are providing care for you, understand that, like, understanding things in terms of this, my sciatic nerve is having an issue. You don't have a sciatica. And if you can help claiming it, don't claim it at all. I got some pains right here because of this matter. Maybe you're sleeping on the wrong mattress. Maybe you haven't stretched out in a while. But yes, like that, those kinds of things also contribute to that condition with the stenosis. It's caused by things like osteoarthritis, where you have that inflammation in the bone that gives you a little less space. And sometimes having something cool around that area, especially when something is inflamed, helps to alleviate some of the pain that you may feel that may be associated with the condition, and gives you a little bit of relief. And we all know once we are in pain, anything that's going to give us a little bit of relief even is well worth it. So even if you're not a person, I don't like cool, but you know what? Your inflammation loves heat. It's like, yeah, give me that heat so I can stay. You want to make sure you're getting it out of there. If you can just provide a little bit of cooling effect for that area that may be, having some pains. Here are a couple conditions that are hereditary conditions, and heredity is one of the factors in having stenosis. So achondroplasia, if you've ever seen, like, what societally we've like known as little people, or someone who is experiencing dwarfism, the condition in of itself is called achondroplasia. And with that condition, it's where it's a bone growth disorder. So your bones really don't grow to the point where they should, and they are making it makes it a little bit difficult, because you have where you should be able to quote unquote stretch out. If your bones grew properly, you would have more room to stretch out. You would have more room to make sure everything is growing properly and things don't really hurt. But with the chondroplasia, they don't have that luxury of having like everything stretch out to the point that it should. It stunts the growth a little bit, causing stenosis in certain parts of their joints and in the spine in particular. You have congenital scoliosis, which is like when they say the lateral spine curvature. Like if you're looking at the front or you're looking at the back, they say lateral. So when you say lateral in medical terms, another thing I said that I would like to do in part of this is like even with the terminologies, to make sure that you guys are educated. So everything that is medial is everything that starts at the center of the body. So you got the chest plate here. The center of the body is called medial, but everything to the right or to the left of that midline is lateral. So lateral, medial. So when you're looking at, say, an x-ray, and you are looking at, they said anything that is the lateral spinal curvature. So if your spine is over this way a little bit or over that way a little bit and it's not lined up with the center part of your body, that is one thing, because you have tendons that are there. Imagine like we're a suspension bridge, and you have the cables that hook to the center beam that hold the bridge up and hold it together. Imagine that being the tendons for our spine, and it's being held this way and it's being held that way. But if in some instances those cables are being pulled to one side or being pulled to the other side, and it's causing the shortness of that bone, because bone is living tissue and it's going to go in whatever way you're pulling at it. So that is a reason why people experience this condition in that way. And some people just have a smaller canal. Like genetically, they just have a smaller canal than most. So you have a spinal cord that may be growing at a normal rate, but it's growing into a space that's too small for it. And that can be a cause of spinal stenosis. Injuries. And like I said, I know that whether I be flipping over a bike or just different falls, or I was trying to do a karate kick when I was like in 5th grade, and doing a karate kick, and at one point looking at the wall, the next point looking at the ceiling, and I had fallen flat on my back. Like the body really does not forget any kind of injury that you do to it. So even starting young, and you figure you're young and you have all the time in the world to get your body right, to get your body in the way that it should be going, you might want to start on that a little bit earlier than you think. So if you're in high school and you figure I have all the time in the world for this, stretch every day still. Because by the time you hit like your 30s and 35 and 40, Your body is starting, you think your body has forsaken you and you almost want to cry a little bit. And it's like, body, why do you not like me? Like, what did I do to you? Like, remember that time you fell when you was 8 and never got it taken care of? Yeah, I'm coming back for you now. I think all of our bodies do that. Like, body is, it's a little petty, if you will. It's like everything that you have done over the course of your life that you haven't corrected, I'm going to show up when you're 30 to 40 years old. How about that? And it's a way for it to get back at us, I swear. Not that it literally wants to get back at us, but those are when things typically show up. So taking care of your body, stretching, having the proper nutrition, having the proper amounts of water, and getting body care, whether that comes through massage, whether that comes through just a good yoga class, and making sure that you are stretching your body and moving your body the way that it should, so we can avoid certain instances of conditions like stenosis. Because one thing that it does do, it hurts tremendously and it comes out of nowhere. There is no warning. There is no, oh, I think I can feel this coming on. It's like one day you're not here. One day it's like, okay, I have a little bit of an ache, and you think you can maybe take a pain reliever, and it may do something for for in the meanwhile, it doesn't completely get rid of things. So what you want to do is have massages. Over time, massage has become one of those things where they're figuring out now that it's not just that luxury item that is for the rich. Because I swear, I have muscle, I have bone. I am not rich. So I kind of think everybody else does that too. I mean, my body stands up, it has structure, and it's because of my bones and my muscles. And like literally all the billions of people on the planet, everybody has bones and muscles. So if you need to take care of it, take care of it. There is so much more that can be said about like this condition, its causes, and different topics that surround it. That's why I've put that information into an ebook. And that ebook is titled Comfort and Care Massage Approaches for Spinal Stenosis Sufferers. I know it's something that I wish that I had when I realized it was a condition that I had, and somebody had put that out there for me. So I figured I'm going to put it out there for others. I found the gap and I want to fill it because this is not fun to deal with at all. The book I'm going to put when it is available on when it's available, I'll put it up on YouTube and say, hey guys, remember that book I was talking about? And there are many more topics that I'm going to be talking about over the next few weeks, so that there's not only a brief rundown of what the condition is and what it's about, but also more information that you can have regarding the condition. I know some of the like chapters go into like the understanding the stenosis, preparing for massage as a part of your pain management, self-massage techniques, because it's like, okay, maybe I can't afford that, but you know what? There are some techniques that you can do by yourself, on yourself, that'll get you the relief that you need until you can maybe say afford to go to your therapist for a formal session. And there's so many more pieces of information that are within the ebook. And if you are one who suffers with spinal stenosis, it's something beneficial and worth having. Even if you don't suffer with it, but you have a family member that may suffer with it and you want to be able to help them, again, it's something that you may want to take the time and invest in. The books are not going to be expensive. They're going to be about $10 a piece, just for some information purposes. I know as things progress, and I'm going to have these things up and online and firing like clockwork. Until then, know the information is there. And in reaching out, if you need those to be sent to you on an individual basis, they can be. And until next time, folks, I encourage you, if you're not taking care of your body, even if you're a younger person and think you have all the time in the world, don't wait until 30 gets here to try to do things you could have done about at 20. Because it hurts. Ask anyone who's in that age bracket and it'll be the one thing that they'll tell you, hey, I wish I had done some things about this just a little bit sooner. Again, this is CC Rex. Want to give you this information. If you have any questions, please don't hesitate to reach out. And again, I ask that all those who are looking at this video, share and subscribe if you know somebody. Let's build a conversation and let's build a community. One small step at a time. Thanks a lot, guys. Enjoy your weekend and see you in the next one.